In today's webinar, we're going to discuss managing employee return to work under OSHA COVID-19 guidance. I'm Mark Heidebrecht. My business partner Sam Bradbury and I are both board certified ergonomists. We're also board certified by the American College of Sports Medicine. We've been in business together since 1998, and as a board certified ergonomist, human factors professional, we look at musculoskeletal injury, but the thing that most people don't realize about board certified ergonomists is if you look at a true science of ergonomics, it's really reducing the chance of human error. And that's really how this fits in with the COVID-19 pandemic that we have and returning people back to the workplace safely, reducing the chance of illness. Our mission at Ergonomics International is to provide occupational safety health tools that objectively identify, quantify, and rank injury and illness risks and lead companies to solutions. And that solutions is the most important part, and that is very easy to come up with what's wrong. It's much different to come up with what are the solutions to make things right, or at least better. At Ergonomics International, we've developed a COVID-19 EMS employee management system. What the system does, it is mobile compatible software, has off-site temperature monitoring. Why off-site? Well, because that's where you can monitor people before they expose other workers to a potential illness or injury. Also has a workstation compliance monitoring tool, which allows us to have the worker or a supervisor walk up to their workstation and identify, is everything present that I need, proper PPE, proper spacing, and guards that might need to be present based upon the OSHA hierarchy. And so it allows individuals and employees to track that, which it provides the essential piece of documentation for the employer, which is going to be critical in this new environment that we're in. It also tracks hygiene efforts, which allows us to use QR codes to track either areas or specific doors, things like that, touch points that need to be cleaned on a regular basis, and tracks that for, again, documentation for that new element that we're in, where we're going to need to show our due diligence of trying to provide a safe, healthy workplace for OSHA. It also identifies and tracks high-risk employees so that if there is an outbreak, we can move them to areas that have less exposure potentially, and it can also track and identify immunity so that if there is another outbreak, we know who we can use to keep our offices up and going and producing product. As many of you know, OSHA has come out with a guidance document just released in March of 2020, and this goes through and cites recommendations, if you will, guidance on how to deal with the pandemic at your workspace regarding COVID-19, but it also lays out very specifically how OSHA can enforce these guidelines under the general duty clause and personal protective equipment. And so it's going to be very important for you guys to become very familiar with this document, because it can be used for citation. So OSHA has developed this interim guidance to prevent worker exposure to COVID-19. The general guidance applies to all U.S. workers and employers. Dependent on where the operation falls in OSHA's risk pyramid is going to determine what level of PPE, social distancing, and guarding that you're going to need. And so our risk software actually allows the employer to identify workstations and which grade they are, because OSHA is very specific in stating that this can change by task or place within a workplace. And so once you identify where a job task is in this risk pyramid, then that allows the worker then to go through a quick checklist each morning or once a week, whatever you determine is appropriate at your workplace, and determine, do I have what's required? And that's going to be very, very important for the documentation standpoint to show that not only have you said that the workstation is safe, but the employee has gone through the checklist and said, yes, I have what I need to do my job safely today. In assessing potential hazards, employers should consider if and when their workers may encounter someone infected with COVID-19 in the course of their duties. Employers should also determine if workers could be exposed to environments such as work sites, or materials, laboratory samples, and waste contaminated with the virus. Stated in this document, it says COVID-19 can be a recordable illness or death if worker is infected as a result of performing the related job duties. And so this is where it's going to be very important for you as a company, an employer, to show that you've taken the measures necessary to provide a safe workplace, because that's what you would be cited under these guidelines, is the OSHA General Duty Clause. In this document, OSHA is very specific about training. It says, training all workers with responsible anticipated occupational exposure to COVID-19 about sources of exposure to the virus, the hazards associated with that exposure, and the appropriate workplace protocols in place to prevent or reduce the likelihood of exposure. Training should include information about how to isolate individuals with suspected or confirmed COVID-19 or other infectious diseases, and how to report possible cases. And this must be done during business hours at no cost to the employee. And this is something that our software does. We have the modules built into the software so that this training can be done very quickly and efficiently and convey the required information. OSHA's guidance document also states you must identify workers who may be at increased susceptibility for COVID-19 infection or complications from COVID-19 and consider adjusting their work responsibilities or locations to minimize exposure. Their flexibilities, if feasible, can help prevent potential exposures among workers who have diabetes, heart or lung issues, or other immunocompromising health conditions. And the COVID-19 EMS software can be used to identify and monitor workers with this increased susceptibility. So in the case of a possible outbreak, we can identify where people can work safely and keep production rolling. People with COVID-19 can experience mild to severe respiratory illness. People with these symptoms or combinations of symptoms may have COVID-19, which include cough, shortness of breath, or difficulty breathing, or two of the following: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. And what the software allows us to do, the mobile compatible format, is a worker, before they come in, they can quickly log in, ask if they have any of the personal risk factors, ask if they have any of these symptoms, and if they answer yes, then it'll flag them where they can be followed up with. So this allows us to identify potential carriers of COVID prior to getting to the workplace, which is going to be critical. These government mandates regarding COVID-19 abatement strategies are forcing companies to scramble to find ways to avoid fines and, even worse, local outbreaks. In this new age, documentation and data are going to separate companies who survive and those who struggle. The COVID-19 EMS employee management system is mobile compatible software. It allows for off-site monitoring for temperature. It has a workplace compliance module. It tracks hygiene and cleaning efforts within the workplace. It also has a COVID-19 awareness training for the employees, which is required by OSHA. It can identify and track high-risk employees, and it can also identify and track immunity. Using COVID-19 EMS reduces employee exposure by gathering temperatures and leading indicators off-site. So employees can gather their temperature and any exposure that they might have had to COVID-19 prior to going to the workplace and exposing other coworkers. So many companies are currently monitoring employees as they come in by gathering temperatures, but no one that I've seen is logging that information and tracking it. And so this software allows us to very simply, with an employee ID number, log that information so we can actually look at trending and see if we start to see people start creeping up. What we've found is actual body temperature is much lower than the 98.6 typically. And so in many cases, they will start to show a fever earlier, and so we can start to monitor and potentially isolate some of those individuals if necessary. So the software can be used off-site to gather could also be used on site to gather and log temperatures as well. So the EMS software also allows employees and/or supervisors to have the ability to log social distancing, guarding, or PPE concerns at the workstation. If a concern is recognized, an email is immediately sent identifying the responsible party so they can assess the situation and make any changes that might be necessary. So you can have an immediate response and documentation that has been followed up on. The COVID-19 EMS software uses QR codes that can be used to track doors and other high touch points to make sure surfaces are being cleaned. This also provides documentation that safe work practices have been followed in the event of a local outbreak. Once a vaccine becomes available, the software can be used to identify who is immune and which areas of the facility are most vulnerable with fewer employees vaccinated. Utilize COVID-19 EMS now to return workers to work safely, start documentation and work practices, and manage recurrences in the fall. Don't let your company or facility become a national headline. Implement data-driven software now that can be used to make evidence-based decisions in the future. The COVID-19 EMS software was developed for large corporations but priced for small businesses. Its introductory price is only $199 a month per facility. If you have any questions at all regarding this mobile compatible software COVID-19 EMS system or any of our other products, give us a call at 913-488-3127, or you can email Sam or myself at mark@ergomethodsinternational.com or sam@ergonomicsinternational.com.